Welcome to Prestige Healthcare Services, your primary source for excellence in home health care. My name is Debbie Giordano, and I'm the administrator at Prestige Healthcare Services. And on behalf of the leadership team, which includes Isdori Layamura and Highness Mina and Augustus Kormar, I welcome you in this orientation video.
Hi, I am Steve Capolini, the Director of Human Resources for Prestige Healthcare Services.
I'd like to tell you a little bit about our agency. We are a full-service agency. We have a skilled division, which has approximately 200 active home health patients, and we service many areas in Massachusetts. Geographically, we service Worcester greater area. We service Springfield, Lowell area, greater Boston area, and also the Fall River area, as well as Leominster, Fitchburg, Douglas, Uxbridge. So we service statewide, and we provide home health services including nursing. We have LPNs, RNs, home health aides. We have physical therapy assistants, occupational therapy, speech therapy, and also a medical social worker that guides our home health team in the skill division. So we provide care to individuals that are referred to us from a doctor's office, from a hospital, from a nursing home, or from whatever source we receive the information. We're very grateful to provide the care, and we consider it a great honor to service patients in the Massachusetts area. Some of the insurances we accept are Medicare, Medicaid. We accept network health. We service patients with Tufts insurance and many other insurances. We also have the ability to care for some of our ASAP groups, such as Massachusetts and Tri-Valley. In this regard, we receive contract information from the Elder Services, and we provide care to those individuals through contract. And then at times there's opportunity from that group, if they become skilled patients, to also service those patients. We also have an adult foster care program and a group adult foster care program. So within our confinements, we're able to service many, many different types of patients. And we provide care to patients 18 and older. And we pride ourselves in continuity of care, in the same nursing staff and physical therapy staff caring for the patients. And we like to establish a wonderful rapport among our patients and the staff that visit them. We have very good outcomes. We review our PI meetings. We actually just had a PI meeting, clinical record review, and we look at our outcomes, and we're continuously trying to improve how we deliver care and what care we deliver to the community. So it's a great honor to welcome you to Prestige Healthcare Services. We'd like to have you become an active member of our team, and we'll provide you the tools to do an excellent job. I'll turn it over to Steve.
One of the challenges with expanding throughout the state is how to hire employees when they're in other cities around the state. It creates challenges. We want to be able to engage our employees, our new hires. We want to be able to go to them in their locations where the employees are, where the patients are. And we find if we can help them and engage them in those areas, they will feel more comfortable with us. They'll feel part of our organization. And in turn, they will help our patients and provide greater services to them as well.
So we are actively recruiting new hires to our organization, and Steve has done a wonderful job as our HR director getting the word out about Prestige Healthcare Services. And many people have reached back out to us to have an interview, to begin working with us. And then our next step is we try to bring them on board in such a way that they'll be very successful. We offer this orientation video as you see, and also shadow visits. We offer them to actually work with current staff. We provide them information and education on the software package we use, which is called Access. And with using this software package and being acclimated to the use of it, we want this to be very successful and a very comfortable experience for all of our new hires so that they can focus on what's most important, and that is the patient. So our primary goal at Prestige Healthcare Services is to make the patient the focus of all of what we do, and to recognize and acknowledge all the individuals that go into making that successful for the patient.
We have a great team here in Worcester, and even though our clinical staff is, again, located all over the state, here in Worcester we have a tremendous quality department, our scheduling department here. We're valuable resources to our field employees out there, and we're just looking to engage them throughout and help them through the process, and it's been quite successful so far.
Yes, and the feedback we receive from the individuals that might get communication either through email or through phone calls has been very good, and we want to be sure that they have that comfort level in reaching back to us. So many ways we communicate. We have a software package called Access, and the email system works very well so that we can get the word out quickly about our patients and about any changes in patients' care. What becomes very important is making sure all the individuals involved with the patient understand those changes, and then communicating that information quickly to the physician and making sure we're doing the very best plan we can for the patient. One of the ways we do that among the team of staff involved with the patient is something called a case conference. So that would be organized in such a way as to bring the individuals that are caring for the patient together. It may not be physically together, but often right in this room we conduct case conferences, and the individuals will call in and we'll discuss the patient care, and we'll see if there's something we might be able to do a little better, or a service we might be able to include. Perhaps the patient has had a fall recently, and we may want to see if we can introduce physical therapy, get an order from the physician, and begin that process as well. So the case conferences become a very important tool for us as well.
Another thing that we've done is last month we began doing off-site meetings for clinical staff located around the state. For instance, we had a nurses meeting in Lowell last month, and coming up this week we will be having a home health aid meeting in Lowell, so that way we can meet those employees in those areas, work with them, and provide them the same resources that they would get if they were here in the Worcester office.
At Prestige, we try to find ways of working with people that may be somewhat out of the box. We look at where we are now and we envision where we will be in the future. We keep a close eye on the current environment, the healthcare environment, both in the state of Massachusetts and nationally, and we need to make adjustments so that we're always on top of what we need to be doing. So I take a lot of pride in the team having that concept, particularly our CEO is Dori Layamura, and our marketing director and our COO, Augustus Kormar. The vision is always about the future. It's about doing the very best we can and establishing those ways to do that.
Yes, we want to grow the right way. We do want to grow, but we want to make sure that our patients are not being underserved while we're doing this. And again, our employees, we have to provide them with the resources and the tools as we grow, and we can't forget who is creating this great resource for our patients, and that is our field employees.
So that gives you a little bit of understanding about Prestige Healthcare Services, and of course we have a comprehensive orientation that we would meet with you as well on all the various aspects of working at Prestige Healthcare Services. Following this video, you will see some specifics from our quality nurse, Llewellyn Kell. She'll go over some of the very key aspects of the nursing care that's involved and some of the specifics that we would want you to be aware of. I find working with Access has been a tremendous resource for our agency. Access actually services 6,000 agencies across the United States. So their resources are refined. The help desk is wonderful. I call them frequently, and I find that they won't stop until they've provided satisfaction or an answer, or perhaps a ticket for a new situation that they may not have thought of. So it's been a great organization to work with, and we'll bring you on board as best we can to understand all those aspects.
And I look forward to working with everybody in the future. Thank you.
Thank you.